Good evening, everyone, and welcome to today's session. I'm Yogita, the moderator for today's session. Our speaker, Ms. Aditi Ratnam, will be presenting on the topic entitled How Mental Health Care Should Change as a Consequences of the COVID-19 Pandemic. Our speaker, Aditi, works as a proofreading intern in the content team at Renix Life Sciences, where she is responsible for content editing and proofreading. She has a bachelor's degree in English from St. Xavier's College, Mumbai, and she is currently completing her master's degree in English with Communication Studies from CHRIST, deemed to be University, Delhi, NCR. Her previous work experiences were at Digital Skillings, Pratham Education Foundation, and Children of Sahara Foundation. Not only has she worked as an editor, proofreader, and content writer, but has also volunteered with multiple organizations working for the betterment of society through education. Here at Renix, she is not only enhancing her skills in technical proofreading, but also learning basic skills of coordination and management of web content. So without further delay, over to you, Aditi.
Thank you so much, Yogita. And good evening, everybody. My name is Aditi, and I will be presenting on the paper How Mental Health Care Should Change as a Consequence of the COVID-19 Pandemic. Its original authors are a panel of authors. They're experts in the mental health and medical field. The leading person is Carmen Moreno, and etc. So the paper, as I mentioned before, is called How Mental Health Care Should Change as a Consequence of the COVID-19 Pandemic, and I have selected the topic of mental health to speak about. The paper is in the journal The Lancet Psychiatry, which has an impact factor of 7708.08, and the year of publication is 2020. It has an impact on COVID-19 and mental health. So before I start my presentation, I would like to give a trigger warning to everyone watching that the following presentation will be talking about death during pandemic, anxiety, depression, and suicide. So with this, I begin my presentation. We're living in 2023, and we've already seen a lot of hindrances due to COVID since 2019 end. So when COVID came, it caused a lot of ruckus due to its lockdown, and this paper basically is a position paper on the mental health response during the pandemic. So in this paper, an international group of mental health experts, service users, providers, and leaders, they sit and they reflect on the mental health challenges posed by COVID, and they come up with solutions to better the service that was given during COVID, and which can be better during the future. So a general background to this paper is that the SARS-CoV-2, or as we know it, the coronavirus or COVID-19, spread across the globe in the late 2019, and it spread first in Wuhan, China, and from there it started to spread to all the major countries that were linked to it by air, by water, by land, and as the months passed, by March 11th, the WHO had pronounced the virus as a global pandemic. So as the days passed during the global pandemic, businesses and companies shut down, people were laid off, and organizations lost money, and the market crashed, basically plunging economies into depression worldwide. And children basically stopped going to school. So the containment and the social isolation that started from March of 2020 was a technical nightmare to every community and to every group all over the world, because not only were people's livelihood based on going to work, but there were daily wage workers who also lost their jobs. And it was just the basic social interaction that we all started to lack from there. So the methodology for this paper was that The scientists, they sat down and they searched for terms like anxiety, depression, mania, manic psychology, schizophrenia, etc., etc., from articles and statistics, and that was published up to May 15, 2020. And through this, they came to an informed research and conclusion, and they took about 28 articles about mental health related to COVID-19 and 24 about adaptations of mental health services during the COVID-19 pandemic. So this basically was a foundation for them to sort of come to an informed conclusion and come up with solutions for the future that could better the mental health care of basically the globe in all the countries around the world. So the objective of the research was three: to bring awareness of the importance of mental health care during trying times like the pandemic, to sum up all the data that reflects the challenges posed by COVID-19 on mental health, to bring about innovations that could be a stepping stone to efficient, prompt, and better mental health. So the panelists started with the topic of potential consequences. So basically, this area talked about how different groups and different large communities of people and what they faced during the pandemic and during the lockdown when that happened. So the general public was their first concentrated community, and they said that phobic anxiety, panic buying, and binge watching television, and which was associated with mood disturbances, sleep disturbances, fatigability, impairment, and in self-regulation, have been reported. And social media exposure has been associated with increased odds of anxiety and combined depression with anxiety. An increase in stress, anger, domestic violence, sexual abuse, alcohol use, etc., were also major issues. So basically, during this time, I myself remember a lot of news articles that that sort of pointed towards increased domestic abuse. I remember there were a lot of debates that went on television due to this as well. And I think phobic anxiety and panic buying extremely uh, were extremely infamous, because I think we've all faced it and we've all been there as well. When the lockdown was announced the day before, everyone went to the stores. The shelves were empty, not only in India, but all across the world. And I think OTT platforms, the basis of OTT platforms was way back, but the time when it started to get really popular was during the COVID-19 pandemic. And I myself watched about, I don't know, maybe about 60 shows during a span of 6 to 7 months. This, by sitting inside, by cooping up inside, basically all of us just became couch potatoes in one way or another. But also that increased a lot of anxiety for a lot of us, and depression as well, because our basic social interaction was not there. I think every one of us needs a little balance in our lives. And even if the most introverted of the introverts say that we like sitting inside, at the end of the day, we all do need to have some social interaction in our lives to keep our minds and our bodies stable. This was a poster that I found. Anxiety. These were like the feelings that could help you identify what you have. So, a lot of me personally, I have dealt with a lot of anxiety since I was a very small child, and for me, all the anxiety-related symptoms were very relatable. And although, touch wood, I've not dealt with depression, but for the people who I know to have dealt with depression, they do have a lot of sleeping problems. They have a lack of concentration, appetite disorders, sensitivity, irritability, low self-esteem, melancholy, etc. So the second group of people were people who had actually had COVID at that time, or who were just cured from COVID. So a lack of contact with the family and loved ones during the quarantine basically caused a lot of instability. And the fact that they just had COVID, and even after they were cured, just the sheer act of not knowing what is going to happen, because COVID at that time was an extremely not, it was not researched well. Like, even though there were a lot of researches that were coming up, it we didn't know COVID as we know it right now. Right now we see people without masks, even though we are facing another COVID situation, but we see people without masks because we already know what is about to happen. Even if we get COVID, we know we can take precautions, we know how to take care of ourselves. But at that time people were extremely paranoid, and that sort of increased the chances of not only getting COVID, but also sort of uh, just falling into more anxiety and falling into more depression after you were cured. Patients also suffered from this executive syndrome, which was, I think, a syndrome that helped them not. It tackled with their sort of uh, neurotic abilities. Like I think they did not. They could not make decisions well. They did not want to make decisions well. And researchers also concluded that the COVID was a neurotropic virus. So this was basically taken from the literature that they had studied, and even I tried to tally it with the internet, and it was in a lot of literature that the virus affects the neurons of the brain, and that sort of emphasized the need to evaluate short-term and long-term effects. The third community that they concentrated on were people with pre-existing mental health disorders. So in this, they basically said that the risk factor of getting infected with the coronavirus were higher for the groups, as the morbidities were high. Elderly people were also included by every government in high-risk categories, and there were numerous drawbacks when it came to providing healthcare for this group, as institutions became epicenters for infection, increased death rates in assisted living facilities, improper care, and in mental health institutions. As a lot of these institutions were extremely overcrowded, and we had not faced a situation like this before, we had to come up with new methods, with new plans to deal with so many people getting COVID, not only inside the institutions but outside as well. There could have been people who at that time were admitted but did not need immediate care, whereas the person who was outside needed immediate care and had to be brought in. So there were a lot of moral dilemmas with the healthcare workers as well during this time. Healthcare workers. So, fear of infecting loved ones, stress exposure, depression, anxiety, insomnia, and distress were, I think, we've all heard about a lot of cases during the COVID and even after COVID. And we've had so many awareness campaigns for healthcare workers, for frontline workers, and I know that as a country and as a globe, we are very thankful to them for all their sacrifices that they've made during the COVID pandemic. And secondly, the moral injury and dilemma were major challenges. Like I mentioned, there could have been times where someone who was beyond saving was in a very critical condition, who had to be let go, versus someone who could be saved with a little more care and attention. So it was things like that sort of that sort of push them into more anxiety, push them into PTSD. The healthcare workers were actually pretty prone to PTSD, as I know some of my own family members who were nurses, who have come out of COVID with anxiety, depression, and PTSD. So through this, they concluded that the mental health care response during the COVID-19 pandemic was not bad, but it was not extremely good as well. But it is kind of understandable, because it was a situation that we were facing for the first time. So they came up with a few methods that a few mental health care services talked about or did during the pandemic. So to avoid confusion, panic, and distress, the public health response should be clear, concise, and accurate. Moreover, social institutions like family, educational organizations, and self-care should form a shield of their own. So basically, mental health care services went out of their way to create awareness that one's own bubble is something that keeps you safe as well, and that should be the foremost circle of shield that could form, uh, that could prevent you from getting affected by the COVID-19 pandemic, by the mental health repercussions that people were having due to it. Community outreach in every country has been immense and prompt. From volunteering to fundraising, we have numerous groups that came up with just to help society survive a terrible time. I volunteered as well during the COVID-19 pandemic, and I was out in this field. I was out in the field in Bombay, helping people from different places reach hospitals. I was trying to get them. I was reassuring the children over there. I was teaching them in a moment of need. I was being with them while their parents were out getting getting treated for COVID-19. So community outreach, I think, is extremely important, and I think we don't know the power that a community could actually have when it comes to trying times like the pandemic. Third, services also took precautions as they started online sessions and temperature screenings. So I think we all remember going into shops. We were all screened for our temperatures. We were all screened for our oxygen levels. And not only education institutions, but mental health services also started to have online sessions. And I think even today, we still retain the online session mode in a lot of mental health services that I know of. Access to appropriate mental health care should have been guaranteed to patients who tested positive for COVID-19. So, as simple as anyone going through a traumatic time, I think anyone going through COVID-19 should also have been told that it's going to be okay, and that they should have been provided with appropriate mental health care to deal with the repercussions that they probably had during their treatment, or during, even probably during their family's treatment. Like, it could be someone whose mother or whose father got affected, or someone who passed away. So someone someone like that needs to have the appropriate support to move on with their lives. Countries have strengthened public health protocol, including how to access mental health support when in need. Countries have also provided healthcare for special populations, especially for frontline workers. Team and team leaders were encouraged to be there for one another in trying times. These populations also include family of those affected. So these were some of the mental health startups during the COVID-19 pandemic. I remember trying to log into a lot of these to help a lot of people around me, and once or twice to help myself as well. Inner R is still a very big app. Your Dose was good. Visa is also a pretty supportive app for mental health issues. What more can be done? So in this, uh, the researchers talk about the solutions that can be that we can come to after we have learned so much in the last 1.5 to 2 years during the COVID-19 pandemic. So they had a few concerns as well. So they also said that as the world socially evolves, we are surrounded by awareness and responsibility. So when in times like Black Lives Matter, I think we all remember that movement. Uh, During that movement, we had a lot of social turbulation around the world. There was a lot of racial turbulation. And I think the pandemic was a very epitome moment where everyone's eyes turned towards healthcare workers, and to see if they also faced, or they also contributed to a social movement like the Black Lives Matter, because I think it is very important to be non-discriminatory during these trying times. Otherwise, of course, I'm sure there were a lot of cases, but I think the globe and all the countries handled the situation pretty well. Service users should be more involved in the development of the healthcare systems. After the pandemic, society, the governments, and the institutions themselves should have realized that the world needs a long-term planning when it comes to healthcare. So not only do we sit with the WHO. We should have an internal disaster management control, especially for pandemics now, because we know that that could happen again. We know that pandemics, if a pandemic can happen in 2020, such an evolved, such a technologically advanced stage, we never know what can happen in 20 years or in 30 years as the world slowly declines in its natural properties as well. Remote therapy is a mode of treatment that is becoming more popular as the days go by. This is also better and possibly cheaper way to connect with people wherever and whenever. As the world becomes digital, healthcare providers have to adapt and evolve too. Timings have become flexible, and there is a constant need to change the way you communicate and respond due to the changing socio-economic and medical scenarios. So I remember a lot of times where there would be a lot of misunderstandings between healthcare workers and customers because of minor inconveniences or time lapses. And I have a feeling during that time, obviously there could have been someone right and wrong, but during that time I think it's very important to try and sit and understand each other and to try and understand that what the other person could be going through at that time of need. Healthcare workers are extremely overworked, so I think it should be best that customers also try to understand them as much as possible and to work in the sacrifices that they make just to be there for us. As the world accepts the reality of a pandemic and as we realize the repercussions it has on the human mind, there is an increasing need to assess game plans for future situations like this, concluding effective procedures and aids that help in mental health settings, deciding on which strategies to prioritize in the future in case of a similar calamity. Use and effectiveness of mental health care should be monitored. Patients and healthcare users should be more involved in this process too. So the impact of the research was basically in 4 points. The research impacts the main area it focuses on, which is mental health care and its treatment. Uh, since this research, the world has seen a rise in systematic and upgraded mental health care with better treatment methods. There has also been a 50% rise in students enrolling in psychology courses in the last 2 years. This could explain why people would want to sort of better the mental health care that they received during the COVID-19 and what they can do for the future as well, which is why we may see a lot of rise in mental health care professionals in the near future. Better awareness and added online support. A lot of free online support has started online. A lot of times I see people approaching me, asking me if I or if anyone needs mental health care support, they can call so and so number. Like Mandavella Foundation is a very impactful website to go on. So it's things like that that sort of have been impacted during the COVID-19, and I'm sure that a lot of many other upgradations are going to come along the way. So, as the world basically braces itself for another wave of COVID-19 in 2023, mental health care systems have grown a lot in the last 2.5 years. From free healthcare to reassuring content online, the world has come a long way. We have grown to understand not only one another but ourselves better in the years spent social distancing. Old methods of mental health care should be refined and renewed, and innovations for new systems should continue. After years of stigma, mental health care is finally a topic all generations now understand. The pandemic, as tragic as it was, did bring the world together somehow. And as I conclude this presentation, I would like everyone to know that no matter what it is, I am obviously not a mental health care professional, but if anyone does need any help, there are numbers and there are foundations in this presentation that you can call and that you can contact. So I hope everyone enjoyed the presentation, and thank you so much. You can feel free to contact me at aditi@renix.org in case of any questions, comments, or discussion. Thank you so much.
Thank you so much, Aditi, for this interesting and illuminating talk. You have shared your thoughts and experiences on the pandemic situation. So thank you so much for sharing your thoughts and experiences. Now I open the floor to audience. We have a question from Vijay Padul. How these findings can be applied in regular medical or psychiatric practice?
Oh, I think so. There are a lot of conclusions. I think that can be when I talked about the effective procedures in AIDS. There are a lot of times that a lot of mental health care services do not do not have online services yet. So at times, big hospitals, like some things that we can trust, like a very close multi-specialty hospital has a huge psychiatric department, but it does not have an online portal that can help people. So it's things like this that can be sort of upgraded, that can be mention to them that this is something that could help, because healthcare at the end of the day isn't just walking into a hospital and getting something done. It can help in a lot of things that come in sort of in a clinical way as well, because a lot of patients in a hospital could also need healthcare. So it's not just that, it's online content as well, it's people reaching out, it's people making themselves available to the public and letting them know that they're that mental healthcare professionals are actually there to help them, and not just to sit in a closed room and book appointments and to walk in only when we have to.
Thank you, Aditi, for such a nice answer. Uh, we have next question from Dr. Nupur. Nupur is saying that it is a nice talk. For a large number of people of general public group, the loss of jobs or fear of loss of jobs was a major cause of the mental depression. What do the researchers say?
The researchers haven't basically concentrated on that. They have included those group of people, but they've not basically said anything for them, which I think is a little unfair as well. When I was reading the paper, I do have to agree with Dr. Nupur that it's just it was a part of the world that I think everyone sort of forgot to look at, or even if we remembered it, so it was just like it wasn't our problem, or even the people who faced a situation like that did not really have that support. So the researchers have not said anything particularly the about that community, but yes, I think it should be a extremely talked about topic, because I know a lot of people who have committed suicide due to losing their jobs and due to not making their homes work. So yeah.
Nupur has another question. Physical meetings reduced, but interaction over social media increased. Does it help in reducing mental depression to some extent?
I think it's extremely contextual as to what kind of social media you're watching. So I think so. If I talked about it personally, I went through a very bad anxiety and depression phase during 2020, and I was on an all-time low. And but at that time, I actually surprisingly did not have social media at all. I was not using social media at all. But at the end of the day, as I said, context matters. So at the moment when I scroll through social media like Instagram, I'm watching videos that start by saying, I know what you're going through, or uh, if you're going through this, I can help you with this. If you're going through this, I can help you with this. There are a lot of modern day reels that talk about just general situations, and a lot of people relate to that. These are the videos that, I mean, sure, there are videos that talk about funny things, there are memes that go around, but none of them get as much content or get as much likes as the videos on mental health get. Like, I follow a few pages as well, and I think like I said, context matters. So there was a different part of the community that went through a lot during the pandemic as well, due to social media. Like, I have a feeling cyberbullying has to have increased during that time. And I'm sure a lot of people were affected by that. But yeah, there's always two sides to a coin.
Yes, Aditi, we can agree with you. There is two different sides of the social media, and hope it clarifies your doubt, Nupur. Next question is from Bharati. What is your opinion on social media in COVID times? Did it show positive impact by showing all the mortality rate statistics, or it deprived the mental status of people further?
Mm, I think during the COVID, during the pandemic, I remember social media's impact being extremely volatile and extremely toxic. From what I experienced, it was that. But after COVID, I think a lot of the things settled down. It was like the dust just came up and everyone could not see for a while. But then as soon as COVID started to go down and things started to calm down, even though there was a lot of grief in the world and there was a lot of sadness due to people having passed away, due to healthcare workers being on the front line 24/7 for days on end, like everyone understood that. And I think everyone sort of humbled down after the pandemic. And I think it got better, but you can never say with social media, honestly. Social media is a very ever changing tool that can be used very easily for propaganda as well. So honestly, you can never say anything specific with social media. Nothing is stable, nothing is ever constant, it's ever changing. And at the moment, social media is a good tool. It is something that connects people. At least that's the side of social media that I know of. But yeah, I do hope that if there are people going through a very bad side of social media or on the bad side of social media, I hope they get through it and they seek help somehow.
Hope it clarifies your doubt, Bharati. Does anyone have any questions? I see no further questions coming from the audience. So again, I want to thank Aditi for the excellent presentation and the very explainable explanation, a good explanation to all the answers from the audience. So we got to learn a lot about the consequences of the COVID-19 pandemic on the mental health in India also and also worldwide. So before we conclude this webinar, I would like to inform everyone that Dr. Vijay Padu will be addressing our next Cell Talk presentation on 11th January 2023, and the topic of his talk will be a molecularly integrated grade for meningioma. So thank you all for being here and for your kind attention. Hope to see you all at the upcoming presentation. Thank you so much.
Thank you, everyone.